the Fox News alert. Health fears are growing amid all the flooding in Texas. So what do people need to be on the lookout for?
Joining us now is Dr. Nicole Saphier. She is a radiologist and is right here in the living room. Thanks for being here.
Good morning, Nicole.
So you've got 5 big things that people need to look out, especially in a situation like this. What's the first one?
Well, the catastrophic flooding that we're seeing right now is without a doubt due to one of America's, or actually America's biggest rainstorm that we've ever had. So, you know, the storm's going to pass, the waters will recede, but the dangers, the health concerns will linger. And the top one is, you know, the water. Pick a toxin, it's in that water. The flood waters are completely contaminated. We have overflowing sewage systems. You have chemical plants that are having explosions that are releasing toxins. You know, the storm hit right in the heart of the petrochemical, you know, capital of Houston. And so you're just seeing mass contamination of this water. You have kids playing in it, people wading in the water. It's now hit everything in the homes, from kids' toys to utensils, and that's a huge concern.
What about drinking water?
Drinking water. Houston right now, their drinking system is intact, but a lot of surrounding areas are without drinking water. Most of the drinking water is contaminated. You see people standing in lines for hours just to get bottles of water. They're rationing water. Do not drink any water unless you know for a fact that it's been cleared as safe.
Yeah, now what about the mosquitoes? Because if you've lived in Houston, you know how humid it is. It's probably 90 degrees there today, and you have the mosquitoes that are going to be produced through the water.
Huge concern. Stagnant water is just a breeding ground for mosquitoes, and we know with mosquitoes comes viruses, comes diseases. You have Zika viruses, West Nile virus, dengue virus. We're going to be seeing a lot more cases of this to come.
When I was preparing for this segment, this one caught me off guard because I wasn't ready for it, but lost medicine. You don't even think about the fact that you leave quickly, you might leave some things behind.
Well, let me tell you, if you were someone who depends on daily medications, this is obviously a huge concern for you. They've had to really focus in on what to do for a lot of people. A lot of people either left medications behind or they brought it with them, but it got contaminated by the water. You cannot take that medication, even though you've dried it out. If it has touched that water, it is no good. So the emergency was, we need the patients who depend on dialysis, oxygen requirements. We've had to really mobilize efforts to get them that treatment, or else they will die. And then what's happening is, because of Hurricane Katrina, they were a little bit prepared for this. They have a lot of medical supplies, such as insulin for diabetics, blood pressure medications, and so they have been able to provide a lot of that. There are over 300,000 pharmacies, I believe, in Texas that are still functioning, and a lot of them have centralized computer systems. So if you have your name, you have your information, you can go to one of them and they can tell you what medications that you take and hopefully be able to provide that for you.
A lot of people are going back home today, tomorrow, or over the weekend. They're going to have to rebuild, and they're worried about mold.
Yes, as the waters come back, things seem to dry out, but you look at that drywall, it may look dry to you, but you need to look inside. Mold is going to grow there. After Hurricane Katrina, after 2 months, half of the homes that were damaged, we found mold in them. And mold can exacerbate asthma, give you lung problems. Think of 9/11 and all of the long-term effects that had to do with lungs. Similar things going to happen here if we have people living in homes where mold is growing.
And the final thing you warn about is the spread of infectious diseases.
Think about it. I have young children, so does Ainsley, so do you, actually. Think of it as a daycare. Kids always have a runny nose, right? That's because you have a lot of kids in a very small area. Now you have tens of thousands of people in rooms that were made for hundreds of people. So you're going to have viruses that are just spread so easily. And as I said, with overflowing sewage systems, you're going to have a lot of disease spread quickly.
Well, it's better to be informed than be caught off guard. So appreciate your expertise this morning.
Thanks, Dr. Saphier.
Thanks, Doctor.